Hi, my name is Jessica Aguayo, and for my last project, I did a replantation rehab. Mine's a little different, so I'm sorry if this is not quite exact what you expect. Okay, so the replantation is a surgical reattachment of a body part that has been cut off from the body. The goal of replantation surgery is to reattach and restore function to as much of the injured part as possible. Sometimes replantation is not possible because there's too much damage to the body part. If the body part can't be reattached, then a prosthetic is needed. A surgeon will not reattach a body part that they think will not work, be painful, or get in the way of a patient's everyday activities. Before surgery, the doctor will explain the procedure, how much a function is likely to going to return following the surgery. Patient must decide whether regaining the use of the body part is worth a long and difficult operation, time in the hospital, and months or years of rehab. The procedure. There are numbers of steps in the replantation process. Damaged tissue is carefully removed. Bone ends are trimmed before they are rejoined. This makes putting together the soft tissue on either side of the wound easier. To successfully replant a body part, the surgeon must repair bone, arteries, nerves, muscles, and tendons. Arteries, veins, nerves, and muscles and tendons are stitched together. Uncovered nerves, tendons, and joints may be covered by a free tissue transfer where a piece of tissue is removed from another part of the body along with arteries and veins. Areas without skin are covered with skin that has been taken from other areas of the body. Recovery. Recovery of use depends on regrowth of two types of nerves: sensory nerves and motor nerves. Sensory nerves carry messages to the brain from different parts of the body to signal pain, pressure, and temperature. Motor nerves carry messages from the brain to muscles to make the body move. Nerves grow about an inch per month, and this fact helps doctor estimate the length of recovery. A patient's role in recovery. The patient has an important role in the recovery process. Smoking causes poor circulation and may cause a loss of blood flow to the replanted part. Also, if the injury occurs in the hand, allowing the replanted part to hang below heart level for extended periods of time may also cause poor circulation to the replanted part and deter recovery. The emotional aspects of the recovery. Replantation can affect the patient's emotional life as well as the body. When bandages are removed, a patient may feel shock, grief, anger, disbelief, or disappointment because the replanted part doesn't look like it did before. This is very common. Talking to a doctor about these feelings helps the patient come to terms with the outcome of the replantation. The doctor may ask a counselor to assist with the process. The patient needs to be strong during the course of recovery. The quality of life is directly related to your attitude and expectations, not just regaining limb use. For physical therapy and rehab. Complete heal of the and surgical wounds is only the beginning of a long process of rehab. Physical therapy and braces are important for the recovery process. Braces are used to protect the newly repaired tendons and to allow movements of the replanted part. Physical therapy exercises are used to prevent the joints from becoming stiff, to keep muscles moving, and minimize formation of scar tissue. After a fully recovered patient may find that they cannot do everything they wish to do or did before the injury and surgery. Many replantation patients are able to return to their normal jobs before the injury and surgery. When this is not possible, patients can seek for a new type of job. Technically, the physical therapy that they have to go through is just technically everything that you do, as in, like, if you broke your leg or had surgery on your leg for something, you would just do the same things. They just mainly focus on your sensors and your nerves, I think. Yeah. When the additional surgery is needed, some patients who have fully recovered from implantation surgery may need additional surgery to regain full use of the part. Some of the most procedures are tenolysis, free tendons from scar tissue, capsulotomy, releases stiff locked joints, tendons or muscle transfer, moves tendons or muscles to an area that needs the tendon or muscle more. Nerve grafting replaces a scarred nerve or a gap in the nerves to improve how the nerve works. or a late amputation that removes the part later because it does not work or has become too painful. The outcomes. The replanted part never regains 100% of its original use, and most doctors consider 60 to 80% an excellent result. Generally speaking, patients who have not injured the joint will get more movement back than those who have. A clean cut part usually works better after replantation than the ones that have been crushed or pulled off. Younger adults have a better chance of growing their nerves back compared with the adults. They may recover more feeling and may regain more movement in the replanted part. Cold weather can be uncomfortable for the patients in replanted parts. It is a frequent complaint, even those who have excellent recovery. So for this video, it's a hand transplant, but it's an animation. It's sort of similar to the replantation. This is obviously just you using a donor, but it's technically the same thing.
In the operating room, the patient is given regional anesthesia. The upper extremity is prepped and draped in a routine sterile manner. The flow of blood is restricted by the use of a special tourniquet placed on the arm. Curved incisions are made on the skin to expose the deeper structures. Dissection is made through the soft tissue to locate the radius and ulna bones. The surgeons first connect the radius bone together using a metal T-plate. A second plate unites the ulna bone on the lateral side. After the plates have been secured, the surgeons begin the process of attaching the tendons. By pulling a tendon, the surgeons are able to flex the finger. They test each tendon, and then all the flexor tendons are connected. The hand and forearm are rotated 180 degrees, and the same process is used to attach the extensor tendons. After all the tendons have been connected, the surgeons are ready to repair the nerves. A powerful microscope is brought into the surgical field to provide the surgeons with a highly detailed view of the nerves. As with the tendons, the two ends of each nerve are brought together. The repair is performed with individual stitches. After the nerves have been repaired, the next step is to connect the arteries. The ends of the arteries are brought together and connected with individual stitches. Once these steps have been completed, the hand is turned 180 degrees and the veins are connected. Once the veins are connected, the use of the microscope is no longer necessary. Now the tourniquet is released. The surgical team watches for the hand to become pink with the return of circulation, and the pulsation of the arteries is observed. The skin is then closed. The patient is admitted to the hospital. Physical therapy will be started within the following week. If rejection is controlled by immunosuppression and the body has accepted the transplant, once again, the patient has use of a very important body part, the hand.
That's all I have, and thank you for watching.